Great. Thank you so much. My name is Amanda Finley. I'm here with COVID-19 long haulers discussion group. I'm excited about this one today. So Mark, please tell us a little bit about yourself and what you do.
Yeah, I'm Mark Johnson, and I am a virologist by training. Just to warn you up front, I am not a clinical doctor. I'm not an epidemiologist. I am not in public health. I spent the last 25 years studying how viruses replicate. But I want to tell you how I got into interest in long COVID is at the start of the pandemic, by some weird twist of communications, the Department of Health asked if I could help stand up a wastewater surveillance project for the state. The state lab didn't really have the capacity. They were completely overwhelmed, and somehow I agreed, basically because no one else would do it, and I thought it was something that needed to be done. And I'd never expected it to last more than 6 months, but we started measuring wastewater, and then we decided to take it to the next level. And I thought, oh, I can sequence the virus from wastewater just to see what lineages are circulating. And this was before there really were lineages. This was before alpha. And at first it was just nothing going on. But then very early on, I found my first, what I called a cryptic lineage, from a sewer shed in St. Louis in early 2021. When I say a cryptic lineage, I mean I detected a SARS-CoV-2 virus, a lineage, a sequence that didn't match anything that had ever been seen in a patient. But it didn't seem to be circulating. It was just from one single sewer shed, and it drove me crazy. It lasted about 2 months, and at one point in time, it was about half of what I was detecting from that sewer shed. And I kind of just decided to figure out, I couldn't figure out what the deal was. Was this just a virus circulating under the surface we didn't know about, or was it an animal population? I just didn't know. So long story short, after studying this for about a year, we finally tracked one down, literally tracked it down manhole by manhole, until we narrowed it down to a company which they didn't have any white-tailed deer or dogs or anything, or anyone in a hospital. It was obviously coming from a person, but what was the most shocking part is that this person was shedding 1,000 times more than a normal acute infection would. So these are examples of, this was my first reality that there can be persistent infections in people that can be completely beneath the radar. And so, I've continued to study these. I'm now up to 48 cryptic lineages I found, which not a single one of them has ever been diagnosed. I don't know who a single one of these patients are, but there are clearly a lot of people out there that have persistent infections. And I know that if I can detect them in wastewater, those are only the extreme examples of people that are shedding ridiculously high amounts of virus, which begs the question, how many more are out there that are shedding smaller amounts of virus or have a persistent infection somewhere else in the body? And it's really just so beg the question, if there are persistent infections, what are the consequences? Is this long COVID? Is this really what causes it? Or are these completely benign? And even if they're benign, what are the long-term consequences of that? And these are all completely unanswered questions at this point. So I continue to study it, but I've gotten a lot of support from people who have long COVID or have experienced it that realize that there's just a lot we don't know. And I don't claim to have the answers, but maybe this has nothing to do with long COVID, but it would be good to check it off the list, because then so that's what I think it brings me to this forum.
Yeah, and I wanted to ask you specifically about the cryptic lineage in Ohio. That caught my attention.
Yeah, so that one was a little different. So most of the cryptic lineages I found myself. Groups sent me wastewater and I sequence it, and we use a different technique that is really good at finding a needle in a haystack. So we can find a lineage in the wastewater, even if it's only a tiny fraction. But the one from Ohio wasn't even my own work. This was Ohio's health department did the sequencing themselves and uploaded it into a database, because that's what you have to do when you're part of the CDC contract. And what was interesting is there was a very distinct lineage. It was a virus that was it was from you can tell how old a virus is because of they have, you can tell from their sequence what they're derived from. It's like you can tell if someone grew up in the 80s if they know, if they call a remote control a clicker, or if they know why it's called a clicker. It's just, they're things that age them. They can tell you how old they are. And the one from Ohio was about 2 years old, and it had a ton of mutations. It makes, I mean, it had more mutations has more mutations for sure than this new one you hear about, the 286. But then we expanded our search and we said, okay, let's look for, how long has it been there? So we just went ahead and searched everything for that specific signature. And it was really interesting because I realized that the exact same lineage was present in two different towns. One was Columbus, Ohio, and the other one was this town called Washington Courthouse, which was about 40 miles away. And as I was looking, the same lineage would show up in both sewer sheds on the same day, more often than not. And sometimes you could see the virus was changing over time, and you could see it change in both sewer sheds on the same day. So it was very clearly from a single source. So presumably it was someone who lived in one of these two places and commuted to the other. And when you look at the wastewater, it was in there for about a year that it was detected. It could have been even longer, but in May, it was going crazy. If you look at the Ohio State sewer shed information, Washington Courthouse had their highest viral levels of the entire pandemic just 2 months ago. And when we got the sequence back, it was entirely from this one person. So it was a massive infection. I don't know how someone could have this infection and not have some kind of side effects, but we never figured out who they were. And then the signal disappeared about a month ago. And so we don't know what's going on. It could be that I don't know. Did they move away? Did they die? Did they get better? It's frustrating. I'll probably never know.
Yeah, that really, that caught my eye. And I had people asking me questions about it on Mastodon. They're like, well, how do you know it's human? And I was like, I know where to ask. Hold on.
Well, I can't prove that it's human, but I can prove that it's from a single source. And I can't think of any animals that would be doing a 40-mile commute every day.
Yeah, right. And they were like, well, how do you know it's not in the cat litter? Well,
yeah. Well, no, that's not a bad hypothesis, because particularly back when we thought that these were coming from animals, we were doing what we call ribosomal RNA testing, where we can see every animal that's contributing to the sewer shed. And because we were looking for the source, and the things that we always found, so we always found what people eat. So we would find cow, pig, and chicken, no matter what. I mean, Manhattan, where I know they're not growing any cattle, you could still find beef. But we always also found cat, dog, and often rat. And I was like, who is flushing their pet? But it's a thing. Apparently, it's a thing. But we found it just about everywhere. But I mean, some of it could be like shelters where they probably have drains or something. But either way, yeah, it's not a bad suggestion, but it's hard to imagine how cats would spread it amongst themselves. They're pretty solitary.
Yeah.
Unless it's from a shelter.
Exactly. Let's see, I'm gonna really quick. So, how do we watch for novel diseases, just in general? How was it first detected, and how did it play out with SARS-CoV-2?
Well, so there are a lot of smart people working on ways of finding things that are new through wastewater testing, but I gotta say, we're not really there yet. We can mostly look for new modifications of what we already have, but that is certainly something that will probably be on the horizon. Pandemic preparedness is a hot topic.
Yeah, as one would hope. And how, when we do have something new, how is it identified and classified?
Well, that's a broad question.
I know, yeah.
Well, so like when SARS-CoV-2 was first identified, people had certain symptoms, and this is what some people do. They sequence just whatever is present in cases of unexplained illnesses. And, it turned out it was a coronavirus. But it's not really what I do.
Yeah, I didn't think that was, but, and this is, let's see. And I wanted to ask you really quickly about I go to the Tango page a lot. Is that, how does that relate to anything? Like, who correlates that? Like, who organizes that? And is that what's used globally, or?
Yeah, Pango is used globally. It's I don't know where the group is headquartered, but it's just there's no everyone complains about how complicated it is, but it's just reflecting what's happening with the virus. It's
I mean, I'm a
I
ding
don't
dong
know.
in Kansas City. I don't, but I can at least get through it.
Yeah, the Pango, yeah, it's just, the virus keeps changing and you have to acknowledge that you have to have a way that at least the scientists can communicate with themselves about what it is we're talking about. There's a new lineage. What is it? I mean, you can just spill off the mutations, or you can say, okay, it's BA 286, which means it's derived from BA2, and it's a mess, which, God, talk about a ridiculously hot topic on social media about there's a group of scientists that name the variants once they become sort of
Right? Yeah.
well, I mean, they aren't just bozos on social media. These are the variant trackers. These are probably the top trackers in the world. I mean, this is the group that found BA 286 after like 4 hours,
Oh my
and alerted the health department was like, you need to watch this, and they were
gosh.
right. I mean, this isn't a bunch of idiots, and they really are trying to communicate better with the public.
Exactly.
So
Maria,
yeah,
who
a
doesn't
lot
like
of
it, but
I mean, I don't actually use the names, but
yeah.
I appreciate that they have sincere interest, and it's not just some guys on social media, but there are a lot of very notable scientists that like stop giving them stupid names. I'm like,
You want
okay,
people to use it or not? Like, do you want their interest or not? Give them something they can pronounce
it's
that makes
it's a
sense.
communication
It
tool. I don't
is, yeah.
know. I can't get that worked up either way.
Right, and they really do. Maria, I saw a post one day. I was like, dude, it's okay. It's okay. Sheila has a really good question here. How
Okay.
often is wastewater tested or monitored?
It depends on the location. In Missouri, we monitor about 90 sites once a week. You can get a little higher resolution going twice a week or maybe 3 times a week, but I can tell you it doesn't help that much. In the beginning of the pandemic, we ended up doing the testing for Boise, Idaho, and they wanted the testing done every day. So they would send us 2 FedExes a week, and we did it every day for like 9 months. And at the same time, I was doing Missouri once a week, and I don't really think I got that much higher resolution from Idaho because it doesn't change in a day. And I don't know. It's people like to have that, be able to draw trend lines and
Yeah.
have a really good idea, but I mean, we kind of, I think in Missouri, we make up for that by the fact that we're sampling so many areas that are all, interconnected. It's not going to just this virus doesn't work in a vacuum. That's one thing I learned very early on that surprised me. I just didn't realize we're dirty little creatures,
God, we are.
I mean, when Delta arrived,
I
so
was
Delta
asking about
wave,
Delta. Thank you. Yeah.
for whatever reason, that it started more or less in Missouri. In the first place we detected it was in Branson, but within 2 weeks, it basically had taken over the state. And we're not talking like St. Louis, Kansas City, like every little rural town. I'm like, how does it even? I didn't know these people travel that much, but it was just. I mean, I think a lot of it was actually that people. I think it was a lot of people taking weekend trips to Branson were bringing it
Going to
home.
the lake. Yep. We're going to the
Well,
lake.
the Lake of the Ozarks is one of the few places we don't test. They're
Oh no,
not.
I'm talking Table Rock Lake. Not Branson. I
Oh,
grew up in
Table Rock. Yeah,
I grew
okay.
up in Joplin, so it was a bloodbath.
Yeah. Yeah. So, yeah.
And I do remember.
Long answer to a short
Yeah.
question. We do it once a week. Some people do it more often, but most people do it. Places do it at least once a week if they're going to monitor.
But when you first started tracking and seeing Delta, uh, how quickly did it escalate? Like it just. I had friends in India. I was watching it there, and then the
Delta was
States here.
special. Well, what's weird, I've posted about this recently. What's strange is that Delta was a big deal in India in February, March. It had really taken over in India by then. And it's not like there weren't cases in the US. There were some, a couple hundred cases before May.
Yeah.
I posted like how many cases there were in March, because it was just like what's happening now with 286. Like there was a case, and then 2 days later there was two, and then three, and then, I mean, it was just not taking off, but it was there. I mean, we kept detecting it, but it wasn't until late April, early May when it sort of caught storm. Like that's when we first detected it in Branson. But then, we're monitoring all these sites, so we could tell a difference. And so, like, I remember the first time I realized what was going on is in the second week. So the first week we only detected in Branson. The second week, I don't know if you remember this, in Lynn County,
Yeah.
Brookfield,
Yeah.
that was
That was cool.
ground zero. Oh my God. But it was overnight. It went from zero to, I mean, the first time I detected Delta in Brookfield, it was 100%. It was just took over, and they were in terrible shape with the cases they were having.
I went to school
Um,
at Truman State, and we used to go to the restaurant.
But so Delta was interesting for a lot of reasons. So, I mean, it was interesting for me because it followed a different pattern. It did not. Most of the lineages sort of follow the population, so we usually see them like in the I-70 belt and up and down to Springfield. I don't know how many people listening are from Missouri, but they basically went where the people are. Whereas Delta didn't. It was popping up randomly in all rural parts of the state, and then towards the end appeared in St. Louis and Kansas City and something like that. It's strange.
Yeah, it was. I don't even know if maybe it was something I had picked up. I tested, but it wasn't really. I don't know. I started having like there was a cluster of something going on in my body in May. It was really different. I mean, it was weird at that point.
Yeah.
Yes. And then to watch it, and then just to watch it decimate the ozarks, like I said, oh my God. That was actually why Ed Yong initially reached out. He wanted to talk about that.
Hmm.
Let's see. So yeah, let's get into the variants that we're watching right now. And everyone who's watching this, if you want to type it, keep your camera and your microphones off, and just type your questions into the chat, okay? And if you're watching on the page, I'll be checking that as well. So yeah, let's talk about what's going on right now.
Okay, so, well, how far back do we want to go? So,
however you want.
towards the beginning of the year, there was a new lineage in town. It wasn't really a new lineage. It was what's called XBB. And it's called XBB because it was actually it was two different viruses that recombined, or they pieced themselves together. It was from two different lineages, but it wasn't that big a deal because they were both BA2 derivatives. So it was kind of like two cousins that married each other. But yeah, anyway, it happened, but it had certain properties that gave it an advantage. And so it sort of became the dominant lineage. It was XBB, and then there was XBB 1.5 and 1.9 and 1.16 are the ones that were the main ones. And it was kind of going along. But then recently they've started spinning off. They found some new combinations that seem to be working better. And so the one you've probably heard about is EG5.
Yeah.
It's got some traction, but it's already being, I don't know if it will ever be dominant because it's got a bunch of cousins. This is a really inbred family. They're all like, they're all interrelated, and they're all coming up with the same combination of mutations independently. We call this convergent evolution, when two different lineages come up with the same combination. So anyway, there's a whole bunch of those they're coming around. So EG is one, and then there's 16.6 and FL15 is one you'll probably start hearing about if something really different doesn't happen. But I have to say, numbers are going in the wrong direction. I mean, everyone's like going up and then leveling off and whatever. There's a slow, steady increase overall. So this is not uncommon for late summer, but we'll see. But the trump card, the wild card here is this. You might have heard of the new one called BA2.86. This one first appeared about 3 weeks ago, and it got us very excited because when it appeared in the database, so all the sequences get in the database, it's not a current lineage. It is, remember how I said you can date things? You can tell that this is a virus that branched off well over a year ago, spring of last year. That's why it's called BA2. but it's got a lot of mutations in its receptor binding domain. So had a whole year to come up with new mutations. And so it's very different than what's circulating now. And so we think it probably was in someone that had a persistent infection from a year and a half ago. And now it started appearing again. And we actually see this often enough. We'll see these lineages that are from persistent infections that are very old. But what was different about this one is that it's actually circulating. So we saw the first case in Israel and we're like, oh, that's interesting. And then the very next day we saw cases in Denmark. And then within a week, we started seeing it in the US. So this thing clearly has some spread capability. And so now we've seen that there's only still 20 some sequences in the database, but it seems to be growing pretty quickly. So we've really got our eye on it.
I think I sent it to you just more to remind myself, but I saw the information out of Scotland, and when they released that, they were like, "This started July what?"
Yeah, I'm not sure if that's this new one though. I think that's
Yeah.
that's the cousins, which I'll call them, the sort of XBB rearrangements that are making progress. But yeah, we don't know what's going to happen with this. Some early indications are that it's highly resistant to our immunity, but it's just not a race car driver the way that Delta was.
Yeah, and that's really what's had me concerned, is that we don't have a lot of mitigations in place, especially here. My child started school 2 weeks ago. No one is wearing a mask.
Yep.
I'm not sure what the potential is going into this, but this thing that is now popping up everywhere.
Yeah, well, right now, overall numbers in Missouri are still low, but it will be interesting to see what happens if it does start to take hold and really become an outbreak like we've seen before, because I'm not sure we have the stomach for lockdowns or anything of the sort again. So, but I'm not in public health. I'm not.
You just tell them what's in the poop.
I'm just telling you, just shit don't lie. I'll tell you what's going on.
Yeah.
It will be what's really is happening, and let the smart people figure out what to do about it.
So if someone does have a question and if you're having problems typing, just raise your hand and I'll get to you. Okay. Let's see here now. Who is this? Sheila. Sheila wants to know if BA286 is the strongest one now. And she's right. She says she's hearing of her friends becoming positive every day. My feed, every other picture is a positive RAT.
So I've heard of a lot of people getting infected lately, and I actually don't think it's 286 yet. I've got a pretty good sense of what's circulating in Missouri. We sequence. I just went through 80 sewer sheds worth of data today. I've got a really good handle of what's happening in Missouri, and I have not seen it yet.
Okay.
But I'm seeing a lot of the others. So I saw every one of those ones I listed that I said are the cousins that are making trouble. Every one of those I saw.
Yeah, it exploded, especially just in the last 2 or 3 days. It was bad about a week or two ago, and then the last few days it just kind of.
Yeah, although I mean, I have to say we are still relatively at low levels. In the big, if you look at where we've been throughout the pandemic, we're still at 10% of what we were at the highs. So, I mean, I can be optimistic or pessimistic. We're way higher than we were at the lows, but way lower than we were at the highs. So
the data is the data.
Yeah.
Exactly. Let's see here. So what's the lag time generally between when something happens and when? I know it's different in different places. You were saying in Boise they run every day. Missouri it's every week. What do you think the general lag time is between the time it arrives and the time we note it?
Oh, you mean a virus between what arrives when a new virus?
Yeah, when someone is contagious with a new virus. What do you have a general idea of what that lag time might be? Because we talked about lag time with hospitalizations being that's a little too late. Wastewater, you can see at least with their hospitalizations.
Well, so with wastewater, you get your readout. So you test however often you test, but it usually only takes a day or two to get the readout.
Okay.
But when you have a new lineage that moves in, it depends upon the lineage. If it's Delta, you often know practically the moment it arrived.
Yeah, that was.
Ones that are more subtle, it takes a couple weeks to realize, oh yeah, numbers are going up and it's associated with the arrival of this lineage. We did a retrospective analysis to try and figure out what the best indicator was of what's going to be bad. You know, like how long, I mean, possibilities were how long it takes the variant to become dominant in a sewer shed, how quickly it spreads across the state. But what really is the best indicator is what happens to the overall wastewater numbers after arrival. Do they go up? So if you see a variant arrive and it coincides with an increase in the wastewater levels, I don't care what your cases say. You may or may not be detecting them, but that is a good indicator that there's something going on.
Yeah, and I think that's the big frustration here. At least in this area, this part in Missouri, I don't know what it's like everywhere else. We have a reticence again. We have this reticence about testing and. Yeah, how do we do this in an era where we're maybe not testing accurately with RATs at home, we're not recording it anyhow?
Well, the RATs I think should still work.
Yeah, they do. I think people don't all use it correctly sometimes. And
oh, that could be, or they're not super sensitive. They're really for detecting acute infection. But I get the question very regularly about whether they still work with the new variant. I have not yet seen a variant where the RATs don't work. Okay. Fortunately, they target a part of the virus that does not mutate very much. Okay. So they tend to keep working. But yeah, some people can't get I know people that are positive by RAT for weeks, and it's surprising, but it happens.
Yeah. What do you think what are some things we can do? Sometimes I feel at a loss. What are some things that we can do to help identify, just as citizens, what's going on, and what can we do to message that? I guess it's more of a public health question, but it was just.
Oh well, yeah, just follow our dashboard. It will tell you what's going on. But what you do with that information,
that's not your thing.
That's a personal decision, and that's a public health messaging.
Just do the data.
Yeah, I gotta say, I'm not as careful as I used to be, but I continue to wear a mask for quite some time, and I might pick one up again if the numbers start really getting high. But yeah, masks do work. I will say that. Vaccinations do a great. I mean, even if the vaccine isn't a perfect hit, it's not like they're still better than flu. I mean, you might get sick, but you're not going to end up in the hospital. They still do a very good job at that. So get your vaccine, even if it's not a perfect match. And if you're worried, the masks do work. I mean, it's very clear.
That's something that we try to emphasize to the group often, right? And make sure that you've got something that fits well. It's got a good seal. Don't be doing that paper and cloth.
Yeah, but I don't want to preach. I'm not.
No, I'm sorry. Yeah,
I'm not saying where I'm just saying if you're worried, there is that. It does work.
Yeah.
I will say that.
Let's see. And I think Brittany, did you have a question? You can go ahead and unmute yourself and just go ahead and ask. And we're going to keep it just to surveillance, wastewater. This isn't. We're not talking long COVID today for once.
Well, you can try me, but I'll just say I don't know.
Right. We hear that a lot anyhow. Go for it, Brittany. Hi.
Thank you for having me. Yeah, basically, and excuse me, I suffer from neurological, so I have some speech difficulties. But yeah, my concern, spike protein is what kind of really hit me hard. And I know the new strain coming out of Missouri from, what I've been reading about that, and I was going to get your take. It says that one does have increased spike protein levels. So I was just going to see if you could confirm that.
Coming out of Missouri.
I'm
not sure I know what lineage you're referring to. I don't know of any lineages at the moment that started out in Missouri.
Yeah, maybe something else.
Yeah, it was like one confirmed case. It's not the other two that are in transmission. It was just one, and it was one video I had watched. So I mean, it's not really well known. I can look it up really fast and comment. I don't know the exact strain that it was, but just from what I was reading, it said it was a lot higher in the spike protein levels with this strain. But there were only like 2 connected so far in the US.
I don't think I've heard
I'm
it
very
before at all. Yeah.
It sounds like 286, but it's not been seen in Missouri yet, so I'm not sure. Yeah,
That
if you look it up,
that's probably my mix up. We've
that's
been talking about Missouri, so that's on my
yeah,
mind.
no, you're good.
also
Brittany,
the
you're good.
new lineage was first detected in Michigan and Ohio, also Midwest. And
Michigan, there you go. Yeah.
and yeah, it's not actually, I don't think we really know it's higher spike. It's higher spike resistance to antibodies, and that we do know. The first reports are finally coming out, but we could kind of tell by the sequence, but we don't really know what's in store for that with that lineage yet, to be honest. Everyone out, and we have no idea, everyone wants to know, what are the clinical manifestations? What kind of,
that question gets me.
I have no idea.
I always tell them the same things they've always been.
Yeah, it's gonna be COVID-like, but it could have a little idiosyncratic. Never mind, I won't try.
I meant what you know, you're good.
Sorry,
but it's
all.
too soon to say. It's just too soon. You need a lot of infections where that's what they have before you can start drawing those conclusions.
Yeah, and the other thing, I really just, I'm not too big on this. What are the symptoms of this one? Because then we start perpetuating this. Oh, this is the list of these, and people ignore any other symptoms, and they don't test.
Yeah, it's this is one of the weird things. I mean, the weird symptoms and how it varies so much to patient. There's a lot we still don't know. I do know that.
Let's see. Well, go ahead, Brittany.
Question. Thank you so much.
Yeah.
Having this meeting, that's definitely beneficial. I'll mask up. COVID's COVID, and we'll continue to precautions.
Yeah.
Cool.
Thank you. Hey, Sheila, did you have another question? If so, go ahead and unmute and come on in, okay? Yeah. How have you seen, like, every year, now that we've been doing this for 100 years, is there a spike that goes up when school starts?
I haven't seen it much yet. Actually, that's not true. In the beginning, we could see a difference, because if we compared like the numbers in Columbia to Jeff City, yeah, you could see an increase when the college kids come back, but it wasn't as big as you might expect.
Okay, well, that's good. That's comforting, because I have a
but every year,
10-year-old.
I mean, there haven't been enough years for you say what's normal. That's for sure.
Right.
Most waves are driven by a new lineage.
Okay.
With very few exceptions.
Yeah.
I do know.
Yeah, Sheila, do you want to type it or do you want to ask? Either way. Okay. She wants to know, can you see wastewater info from other states?
Oh, sure. There's lots of ways. So the CDC has their NWSS website where you can look up the whole country, and we actually do some testing for a few other states, but it's a little bit here and there. And also we spend a lot. Most of the groups that do testing for the CDC upload their sequence data, and we look through it routinely to see what they've missed. So yeah, I'm watching wastewater from all over the country and all over the world.
That's really cool. Okay, iPad 2, whoever you are, go ahead and ask. I don't know who iPad 2 is.
Someone has their hand up.
Yeah,
Go ahead.
if you got your hand up, go ahead. You can unmute. Right here, I'll unmute you, okay? All right, I guess I can't. You have to unmute yourself. Do you know how to unmute? I don't know how it works on an iPad.
There we go.
Okay, there you are.
Hi, I'm Laura, and
hi, Laura.
hi there. Anyway, I was wondering how confident I should feel in my ability to assess my current exposure risk with just wastewater numbers as compared to wastewater plus COVID positivity rates. What have we lost? without not having COVID positivity rates and case numbers and all that?
To be honest, I don't have high confidence in positivity rates. I think that they're less reliable now than they were in the past because it's sort of a select group that's being tested. I think the wastewater is going to give you a good job of telling you the big picture, but it's the big picture. We aren't telling you about an individual or, an individual location. The things I pay most attention to myself are wastewater numbers and hospitalization. Those numbers tend to be more constant. Yeah. Positivity also varies from place to place in terms of where you get the numbers, but I don't pay much attention to that these days anyway.
It might have been used to been good to use as a metric when everybody was testing and there's a
Yeah.
lot of data, but not anymore, certainly.
Yeah. And how much testing is done really varies so much more from place to place now. I know someone who went into urgent care because they had crackling in their lungs. And they went in and they took a chest x-ray and they said, no, it's not really, it's okay. Go ahead and go home. And he was asking me whether he should go to work. And I'm like, have you taken a COVID test? Did they give you one? And he said, no.
Oh my gosh.
So I'm like, well, take a COVID test before you go to work. And he wrote back like 30 seconds later. He's like, yeah, I'm positive. I'm like, you went to urgent care with crackling in your lungs and they didn't even check. I mean,
yep.
It's amazing. Yeah, I positivity doesn't, I don't know.
Yeah, right.
Can I ask, I'm wondering about hospitalizations, if they give adequate estimates of risk with these new highly transmissible so-called milder variants, as far as, when most transmission occurs with asymptomatic and mild cases. And we long haulers have to worry about asymptomatic and mild cases a lot, though you get more long COVID from a severe case yourself.
Actually, that is not true, but go ahead.
But there's more, for a particular case, but there's more of long COVID stems from asymptomatic and mild cases just because of the sheer number of them. So I wonder how much, as a long hauler, to pay attention to hospitalizations compared to wastewater.
Okay. I am not a medical doctor or an epidemiologist, so I won't claim to know things, but I will claim that I know when other people don't know what they're talking about. I think that there's people, no, because I hear this too about, oh, this is a highly transmissible asymptomatic. No, there are no lineages that really fit neatly into that category, because that might be the consequence at this moment in time, but that probably has as much to do with the population being infected as the lineage itself. So when you have a population that for the most part has some immunity now, you're more likely to have asymptomatic infections. And there will be lineages that are better at sort of breaking through and causing an infection. But I don't know. I guess you could call them highly transmissible, but I can't think of any that at least now fit neatly into that box description of highly transmissible asymptomatic.
They're supposedly milder, though, as opposed to the earlier ones where we had bodies stacked in morgues and trailers and people were dying left and right, and they consider it milder.
That's the consequence, but I'm not sure it's because the virus has changed. I think that's because we have changed. I think we're more resistant. I mean, I think the virus is I've gotten into big fights about this. Was Omicron more or less pathogenic? The studies that have the best view of this say at the end of the day, they were more or less the same. But the end effect was still that Omicron was much milder. It infected a ton more people, but most of those people had some immunity, so it wasn't as severe. but I don't, I'm not sure that it was entirely because of the virus having changed. Although, I mean, there was some of that, I think, because of where it replicated. But in terms of the modern circulating viruses, most of what we're seeing now is all pretty closely related. But the end effect is the same. So maybe I shouldn't be so nitpicky about this. At the end of the day, there's viruses that spread, and if you have some immunity, it's less likely to be severe.
My own personal experience is that I wore an N95 mask and did fine. And then as soon as the supposedly more transmissible variant that came around in January came by, I got infected with a minuscule exposure, just 1 minute on an elevator, probably, with the same N95 mask on, and turned positive. And I've been COVID positive for 7 months from it.
Jeez.
Oh my God.
Goodness, I did not know that, Laura. Wow.
So when you say positive, you actually by what metric? How do you measure it?
The over-the-counter test.
Really?
A quick view, yeah. And I can't get fit tested for a respirator because they don't want me to come in because I'm COVID positive, so I can't get any medical care.
Hey, Laura,
safely.
Let's talk later. I'll see if I can get you over now.
That's God, I wish I could take clinical samples. I'd love to know which lineage you actually have.
I'd love to send it to you.
I'm working on an IRB that people could send me. Well, what I'm trying to get is stool samples of people who think that they have long-term GI. And right now, you got to do the whole informed consent thing. And I've never worked with clinical samples before. Wastewater, even that was a step for me. But I'm trying to get an IRB so I can receive them and actually figure this out, because I'd love to know what lineage you have.
Yeah.
Is it really something?
I would love to know too. Or
is this really a lineage from way back when? I mean, it could be. I just saw today in one of the Missouri sewer sheds that there was a BA5. I'm like, wow, that's
really? Still?
Yeah.
Wow.
Only in one sewer shed. It wasn't a major amount, but I was like, oh wow, there's an old timer. That was about a year ago.
Okay. Is there a way I can contact you and find out when you get your IRB?
You can follow me on Twitter, because that's where anything, if it gets approved, I have to have the exact language I'm going to use. And so I would put it into a tweet.
Okay, I'm not on Twitter, but okay.
That's okay. I'll make sure.
Okay. Thanks, sweetie.
Yeah, absolutely. And Brittany, you've been waiting patiently with your hand up. Go for it.
Thank you again. Yeah, so I know we weren't much going into long COVID, but yeah, definitely mild infection for me. Been on oxygen, GI bleeds. I've been bed bound, wheelchair bound, completely disabled throughout this whole ordeal. COVID 3 times, and I'm on a lot of experimental treatments. And I'm on anticoagulant. I've got myocarditis at 36. I'm about to have stents put in as well. And then you brought up a great point about the testing, the at-home testing. That was going to be my next question, because I know there were a lot of changes around. For one, with me being immunocompromised, I definitely don't want to go to an urgent care and expose myself and have that test. But for insurance companies, what's your recommendation if I were to do at-home tests, because I do have school-age children? Do I send that off to a doctor? Do I need to then go into an urgent care? That way, it's handled through the proper channels. I guess.
Is it that you want to know the lineage? You want to see whether it is really a persistent infection, or, I mean, that you don't have to do anything. There are ways to report it, but I'm trying to figure out what you want to get out of it.
You just mean testing in general, Brittany?
Yeah, so I'm working with a doctor who's on the board of the FLCCC. He's actually a doctor that's assisting me, and he has been performing a lot of genetic testing. So we are working with that. I guess just guidance, because so much has changed, and I'm unable to drive, get out in public. But again, like with my insurance, I've run into some difficulties because we are doing at-home tests. So I don't necessarily have that paper. I have a photo showing where I'm COVID positive.
I can actually, and we're kind of getting more into like the public health aspect. We're just focusing on like surveillance and the actual lineages here, but I do have an idea. So I'll send you a message later on, okay? So shoot me a message really quick on Messenger on Facebook, so that way I can find you really easily, okay? Because I know a place where you can take care of this.
Thank you so much.
Oh yeah, sure thing. Let's see. Oh, and Laura, actually, if you're still around, Laura.
Yeah.
Yeah,
Can you hear me?
Chris Strunk wanted to know what brand of COVID test you're using and how
Quick view. It's been very good showing that mine, I'm positive. My husband consistently tests negative, and you can tell us apart.
Wow.
So it's been very good. It doesn't give false negatives like these other ones often do.
That's good to know. Let's see. Do we have any other questions? I'm going to check really quick in the group here. I know we had Caleb in here. He's actually in Liberia. He had a question, but I think he had some connectivity issues.
Christine asked what the name of the brand was again.
Yeah, quick view. Here, I'll type it in there for you, Christine. Yeah, and you can get the quick view test like any of the major drugstores. Now, when it comes to, I'm gonna hit back on this with let's see this. Okay. Where was I going with this? Oh yeah, I wanted to get back to this because that's something that we did start seeing fairly early on. This concept of persistence, especially in the gut.
Mhm.
Are there things? Is there a way to test or do anything with that at home? I literally have seen people try to take a rat, an RAT, and do a stool sample on it. Does that even work?
All right. So the ones you buy in the US are not licensed for that.
Yeah.
There are where it is explicitly licensed for that, and it's the same test. And I know that there have been wastewater samples that have been really high levels that we could detect with a rat. So I think it can work, but I can't say
Yeah.
definitive, but I do know that there are people that are shedding a ton in their GI, enough that it would easily set off an RAT. There are groups to study this, just not enough in my opinion. And there's a lab in Washington that will do stool testing for doctor if you think that's what's going on.
I think that's where a lot. If we have persistence going on, I think most of it is GI, probably some neuro in the brain. Those are the two big things.
But yeah, I see what I mean. Everyone jumps immediately to the people with persistent infections. Oh, those have to be people who are immune compromised, which it might be, but I think people jump to that conclusion a little bit quickly because we don't really know. There's another coronavirus that if any of you have cats, you've probably heard of, a feline coronavirus. And they also get infections in their gut, and those infections can last for years. And it's which cats get this persistent infection has nothing to do with whether they're immune compromised. It has more to do whether they came out of a shelter, whether they've been exposed to it. And, most of the time it's relatively asymptomatic unless it progresses, in which case it's a death sentence. But it's not so simple as immune compromised cats get persistent infection. I mean, it's not a perfect model, but we don't have a perfect model. But I don't automatically assume that this is only going to be in people that have known immunocompromised situations. But time will tell. Won't know the answer unless we ask the questions.
Great. And that was, well, and then when I reached out to you a few months ago, that was the question that I got from a guy in Germany. How do you know it's not a cat as opposed to a human?
Yeah, it's human. Sorry.
I know. That was what I told him. He was fine with the explanation.
In the cases where we've tracked it down, it very clearly was not an animal. And once we figured out how much one person can shed, there's really no reason to try and invoke an animal. It's too many parts of it just don't make sense with it being an animal. I mean, like, it's also like you see, it's been in deer for years, but when you look at the deer viruses, they are not evolving the same way. They're not doing the same thing that our persistent infections are, because they're not under the same selective pressure. I mean, I'm really not worried about the deer viruses going back, because they don't look like they would be a problem.
Yeah, that was that when the guy in Germany reached out. Actually, that's a very good question. Let me find out. Are there any? I don't have any more questions here. Do you have any final thoughts? Just tie it.
I don't think this is over, but yeah. I think we've got a lot to learn yet, and I'm really hopeful that we'll be able to figure some things out that will be able to help your population. I mean, people that are long haulers. No promises, but you know, are learning. So, and I'll test.
I'm sorry, Carrie had a question. Go for it, Carrie. I'm sorry.
Okay. Oh, thank you.
Yeah, you're so welcome.
So many things going through my head, and I thought, well, maybe go with the last one. I just had, I never had staph infections, and I had COVID really bad September 2021, and then December 2021 is the first time I got a staph infection, but they've been reoccurring since then. And I was just recently told by a dermatologist, you are a carrier, and that's it. You know, you're a carrier, and let's just give you this ointment or this antibiotic, you know, and just deal with it. Well, I think it's making me ill and more sick. So that gets confusing to how to handle symptoms that do come up where I'm, you know, paying to go to the doctor and leaving with so sad, you know.
Antibiotics for the, you said, what was it? You say it was staph, or?
Yeah.
How long did they have you taking the antibiotics?
The first round, trying to think, was that, if I may say, it was a clindamycin that I took. I don't know if it was 2 weeks, 3 weeks. It wasn't like real long. Then they have an ointment. So this, I just went a month ago because another one came up just in May. And she said, wherever you, sorry, Mark.
So you took a 3-week treatment of antibiotics and then it still rebounded?
And 3 or 4 times already.
It was still the same infection, that it was persisting through the 3 weeks of treatment?
They did do lab and they checked each time and said, you have staph, and we're going to, I do like the dermatologist, by the way, she's very nice. But the last one, mine wasn't available. So I saw a different one in the office, and a month ago, she said, wherever you see a cut, bite, put the ointment, starts with an M, can't think of it. But she said, put an ointment there. What? Sorry, Amanda?
Mupirocin, probably MUP.
Yes, yes. And she also said, put that underneath the nose once a year for a whole week, because that's where it comes. It's the infection starts, it comes from the nose. I'm like, this is fine, but I don't need to do this for the rest of my life. There has to be, and I never had staph infection, MRSA in my life.
Wow. I wish I knew what to tell you. That's strange.
Yeah, it is. And I'm thinking, since I was in the hospital September for about 6 days, thankfully, because they wanted to kick me out. But I made them keep me. And thank God, the day they wanted to kick me out, my blood pressure dropped 63/30, like 2 hours after, when I had to convince them to keep me. Because I mean, I thank God I wasn't on a ventilator and all that. Mine was more lightheaded, dizziness, throwing up, feeling I can't move. The room spins. So I felt just as bad as but they needed the room, basically. I understand because COVID was really still bad there in 2021, but so it's maddening, and it feels so good to know that we're not alone. That's why I came on here. It's like, I feel so sad for all of us, but at the same time, like, at least we're not alone, can receive support for each other.
Yeah.
And let me ask Mohammed, Mohammed, the guy we do the GI town halls with. I'll see what he's up to, and maybe we could do another GI town hall with him. He would be a really good person to ask.
I got severe digestive issues too
Oh,
that
yeah.
can't, and yeah.
Yeah, go watch the GI town halls. I'll send you the link for YouTube later. It's great.
Oh, wow.
Yeah.
Thank you.
Yeah, no problem. Let's see, does anybody else have any questions before I just rudely ignore you again?
Oh,
See anybody? Laura, did you have anything else you wanted to ask? You still here? Well, I think that's it. Thank you so much for your time today, Mark. I appreciate it.
Well, I appreciate you listening to me, and I wish you all the best.
Okay, you take care. Have a great
Take care.
night, everyone.